Hi guys, and welcome to our module on the species of the lower limb. The species of the lower limb include specific sites where various contents like neurovascular structures are found. The various species of the lower limb that we'll be speaking about in specifics in this particular module includes the femoral triangle, the femoral canal, the adductor canal, and the popliteal fossa. The femoral triangle is the first space we're talking about for the lower limb. It is a triangular space that is found in the superior medial aspect of the anterior thigh. It is specifically located in the upper one third of the thigh. If you're to divide the thigh into thirds, this is the upper one third, this is the middle third, and this is the lower one third. And the femoral triangle is found at the upper one third at the superior medial aspect of the thigh. It serves as a passage for a number of neurovascular structures from the lower trunk all the way down to the lower limb. What are the boundaries of the femoral triangle? The femoral triangle is bounded superiorly, laterally, and medially by a number of structures. It is bounded superiorly by the inguinal ligament, forms the base of that triangle. It is bounded laterally by the medial border of the sartorius muscle. You can see the sartorius muscle here on the lateral side. The medial border of the sartorius muscle, the part pointing towards the midline, is the lateral part or lateral boundary of the femoral triangle, and it is bounded medially by the medial border of adductor longus. So please do remember that although the medial border of sartorius bounds it laterally, the medial border of adductor longus bounds it medially. So medial, and this is one area that they love to test and confuse you on. So just please remember that it's always medial borders of both the sartorius and the adductor longus that bounds it laterally and medially respectively. The fascia lata forms the roof of the femoral triangle, and the floor of the femoral triangle is formed by a combination of three major muscles: the adductor longus muscle, the iliopsoas muscle, and the pectineus muscle. Let's talk about the contents of the femoral triangle. The contents of the femoral triangle from lateral to medial includes the femoral nerve, that's the most lateral structure, followed by the femoral branch of genitofemoral nerve, then the femoral artery and veins wrapped around by the femoral sheath, then the femoral canal and lymphatic structure. So you can look at the picture down below, you'll see the arrangement of the contents of the femoral triangle. From lateral, you have the femoral nerve, followed by the femoral branch of genitofemoral nerve just somewhere around this point. Then the femoral artery and femoral vein wrapped around by the femoral sheath. Then we have the femoral canal just medial to the femoral vein and lymphatics found within that area. The second space of the lower limb is the femoral canal. Femoral canal is a cylindrical space that is enclosed within the femoral sheath. It tends to be wider in females compared to males, and that is because of the biologic makeup of female in terms of the hip size. Hip sizes of females tend to be larger, and as a result, this affects the size of the femoral canal. This is an image of the femoral canal. You can see it on the medial aspect of the femoral sheath, just medial to the femoral nerve. What are the boundaries of the femoral canal? It's bounded anteriorly, posteriorly, medially, and laterally by various structures. It's bounded anteriorly by the inguinal ligament. As you can see, this is the inguinal ligament here bounding it anteriorly. It's bounded posteriorly by the pubic ramus and the pectineus ligament. Pectineus ligament is found at the back here, together with the pubic ramus, which extends to it. It's bounded medially by the lacunar ligament. Lacunar ligament is an extension of the inguinal ligament that curves medially to surround the femoral canal, and it's bounded laterally by the femoral vein. You can see the femoral vein just sitting lateral to the femoral canal. And then the contents of the femoral canal are two major structures. It contains lymphatics, which is what we can see here in green. Usually the deep lymphatic nodes or knockets alongside lymphatic vessels are found in the femoral canal. And the surrounding these structures are loose areolar tissues that are not necessarily shown in the image below. Let's talk about the adductor canal. The adductor canal is an intermuscular tunnel in the medial aspect of the posterior thigh. It's located in the middle one third of the thigh, and this is in contrast to the femoral triangle. Remember, the femoral triangle is found in the upper one third of the thigh on the superior medial aspect. For the adductor canal, it's found in the middle one third, extending to the lower one third of the thigh in the medial aspect of the posterior thigh. In terms of its extent, it extends from the apex of the femoral triangle down to a point uh, called the adductor hiatus, and it serves as a passageway for neurovascular structures moving from the thigh down to the knee. The adductor canal is also known as the Hunter's Canal, and this is by virtue of the person that discovered the canal. He named this canal after him, and that's what we tend to usually call it if we don't want to refer to it as the adductor canal. Boundaries of the adductor canal include the anteromedial, posterior, and anterolateral boundaries. The anteromedial boundary is formed by the sartorius muscle. This is the anteromedial boundary of the adductor canal. So the sartorius muscle is the only structure bounding it. The posterior boundary is formed by a combination of the adductor longus muscle here and the adductor magnus muscle here. And then finally, the anterolateral boundary is formed by a singular muscle called the vastus medialis muscle. Let's talk about the contents of the adductor canal. The adductor canal contains neovascular structures. This includes the femoral vein, femoral artery, saphenous nerve, which is a continuation of the femoral nerve, and the nerve to the vastus medialis. All of this are shown in image below. You can see that they are all color coded. The yellow structures there serves as the nerves, the blue serves as veins, and the red serves as the artery or in the content of the adductor canal. The final space of the lower limb we'll talk about is the popliteal fossa. This is a diamond-shaped structure or space found at the posterior part of the knee. It serves as a passageway for neurovascular structures coming from the knee and entering into the leg. And we'll talk about each of the boundaries and the contents of the popliteal fossa in the next slide. So what are the boundaries of the popliteal fossa? The popliteal fossa is bounded superior-medially, superior-laterally, inferior-medially, and inferior-laterally by a number of muscular structures. Superior-medially is bounded by the semi-membranosus and semi-tendinosus muscles, as you can see. So the muscles here in yellow. Superior-laterally is bounded by the biceps femoris muscle in red. Inferior-medially and inferior-laterally is bounded by the two heads of the gastrocnemius muscle. It's bounded by the medial head that's inferior-medially and the lateral head that's inferior-laterally. And each of these boundaries would form that diamond-shaped structure, which we call the popliteal fossa. The roof of the popliteal fossa is formed by the deep fascia, or we call the popliteal fascia, and the overlying skin, and the floor of the popliteal fossa is formed by the knee joint. What are the contents of the popliteal fossa? These contents include structures that extend superficially to deep, and they are the tibial nerve, the common peroneal nerve, which are branches of the sciatic nerve, the popliteal vein, the popliteal artery, and the popliteal lymph nodes, and these are all structures found in popliteal fossa. Remember that tibial and common peroneal are the most superficial structures, and the popliteal artery and lymph nodes are the deepest structures in the popliteal fossa. Some clinical significance to note. First would be the femoral triangle. Femoral hernias could occur at the femoral triangle. This is contrast to a inguinal hernia. One way to distinguish the femoral hernia from an inguinal hernia is that femoral hernias tend to be found inferior to the inguinal ligament and usually lateral to the pubic tubercle. And remember that the femoral triangle is bounded superiorly by the inguinal ligament. Another would be in terms of the popliteal cyst and popliteal artery aneurysm. These are clinical significances of the popliteal fossa. You could have a swelling at the popliteal fossa, which could either be a cyst due to lymph node enlargement, or it could be an aneurysm due to dilatation of the popliteal artery. And then we could have regional anesthesia at the popliteal area or at the femoral triangle. And these are other forms of clinical significance, so not so important to note. And that concludes our module on the species of the lower limb.